Join us every Tuesday at 10 a.m. You can also reach us on Facebook at Deplorable Rhetoric, on Instagram, Deplorable_Rhetoric, and on Twitter, we rant the number 2 rate.
All right, good morning, everybody. Welcome to She's a Boss Radio, 24 hours, 7 days a week. Focus on topics that build, strengthen, inspire, as well as motivate men, women, and youth from the home to the conference room and around our community. I'm Sigourney,
Ron.
and we're Deplorable Rhetoric. If you want to call the show to talk to us, you can dial 443-272-5922. You can join us on she'sthebossradio.com and watch us there. You can go to tunein.com or Shoutcast or tell Alexa Siri to play She's the Boss Radio. You can also go to Facebook and like She's the Boss Radio to get notifications. You can go to Twitter at She's the Boss Radio. IG is WSTBRN, and Twitch and Tumblr are WSTBR. Okay, so I am going to talk COVID. Not much because I don't have much. But let me see. So I did come across one article, and I'm kind of glad I did because, to be honest, when it comes to COVID, I honestly don't think about the immune compromised people too much. But this article talks about how they're kind of getting left behind, I think, in all the craziness that is going on with COVID. And so the article that is from the Atlantic says that as the United States nears its numbing millionth COVID death and shrugs its shoulders at a rise in cases, some Americans are feeling left behind. Immunocompromised people have suffered disproportionately throughout the pandemic, and even those who have been fully vaccinated wonder if they're really safe. News stories highlight their struggle to adapt to a society that doesn't seem to care whether they survive. I could just go outside, and within 2 weeks, I could be dead, said a fibromyalgia sufferer who told ABC News that last month. She went on to say, it kind of feels like immune compromised people are getting sacrificed. So this dramatic coverage underscores the continuing risk of the pandemic, especially for those who are the most vulnerable. Immunocompromised people who get vaccinated aren't quite as safe as the general vaccinated population. The degree of added risk depends on the underlying condition. But well-intentioned stories on this issue sometimes overstate the case, claiming that COVID shots for the immune-compromised are ineffective or cannot work on everyone. Well, I hadn't come across that yet, so that's kind of scary for them. I mean, I'm sure having whatever condition they have will make things worse, but I at least thought that the vaccine was helping as much as it was helping us, but I guess not. So what did I say? Oh, claiming the shot. Oh, so no, that is incorrect. And it hinders uptake of vaccines. The shots do provide these patients with very meaningful protection as a rule. Jennifer Nuzzo, the director of the Pandemic Center at Brown University School of Public Health, told me. To suggest otherwise is just a complete distortion. It's just scaring people and it's not saving lives. But why would anybody tell immune compromised people that the vaccines don't work for them?
Well, they do. A lot of people are saying a lot of nonsensical things, and people are believing it.
So further down the article says there is a silver lining. Antibodies matter, but they matter most for preventing illness at any level of severity. Regarding the most dangerous outcomes from disease, recent research from the CDC indicates that shot for shot, the immune compromised achieve most of the same benefits as healthy people. One study published in March looked at the pandemic's Delta wave and found that 3 doses of mRNA vaccine gave immune compromised people 87% protection against hospitalization compared with 97% for others. Another CDC report also out last month suggested that on the very worst outcomes, the need for a breathing tube or death, mRNA vaccines were 74% effective for immune-compromised patients, including many who hadn't gotten all their shots, and 92% effective for the immune-competent. So, I mean, that's good to know, at least for them. At least they know that. Oh, God, something about Baltimore County. But, yeah, so at least they know that they can get some protection with all that. That's good. There was another article but that I was reading, but it was talking about let me see if I can get Oh wow! So I just saw this. Beijing tests 20 million residents amid fast and furious Omicron outbreak. So Beijing has rolled out mass COVID testing for nearly 20 million residents in most of the city as authorities race to contain a fresh Omicron outbreak that has sparked pandemic buying amid fears of Shanghai-style lockdown. And I saw that yesterday. I mean, yeah, they are rushing the stores trying to buy up all this stuff because they're afraid another shutdown is going to come.
It's imminent.
But as of 8 p.m., nearly 3.7 million tests had been carried out, with more than 500,000 having returned a negative result, city officials said at a late night news conference.
But I feel like, sorry to cut you off, but I feel like they tend to follow their government rule.
Well, and I was
They
just going to
have no
say, they're much
choice.
more efficient than
Yeah.
whatever it is that we're doing here.
Efficient is not what we call us.
Yeah, not exactly.
We'll get to it when we get to it.
Right.
On my deathbed.
The officials also announced that mass testing would be expanded Tuesday to all but 5 outlying districts of the capital, covering about 19.5 million of the city's 21.5 million residents. But yeah, I mean, like when it comes time to doing something, they're getting it done. You know, they're not.
That's why they're ahead of us on a lot of things.
All right, so effectiveness. This is from Healthline. Effectiveness of Pfizer. Actually, and the other one was from CNN. But this one says Pfizer's effectiveness of Pfizer's COVID-19 booster shot may drop from 85% to 55% after 3 months. So this goes in line with the other article we read about the 65 and older crew. Researchers analyzed over 11,000 hospital admissions and emergency department visits to see how effective COVID-19 vaccines prevent illness. They found that the 3 doses of the Pfizer mRNA COVID-19 vaccine are very effective at preventing hospitalizations initially. While that high level of efficacy wanes, experts say the vaccines still provide key protection against COVID. So while it's good, but once it starts to go down, it's not so good. So they focused on Kaiser Permanente patient records in Southern California from December 1st, 2021 through February 6, 2022, when Delta and Omicron variants were circulating. That time period was also the peak of the Omicron wave in California. According to researchers, after 2 doses of the vaccine effectiveness against Omicron was 41% against hospital admissions and 31% against hospital department visits at 9 months. And so there you go with that.
What pisses me off is that when we first got our first 2 doses, in the beginning, we weren't told that after 6 months it didn't matter. We were not secure. We weren't vaccinated anymore after 6 months. In fact, how do you say it?
I mean, yeah, and that changed too, because before we
right,
got
they
it,
changed
it was like
it so
a
many
year
times.
Or whatever.
Yeah, and I understand that they had to put it out there. They, study while we're injecting you with the Pfizer or Moderna shots. And I get it. That's how vaccines work, especially it was a dire situation. So they had to get this out there. And it just, I'm over it. I'm over all of this COVID crap. I just wish people would make sure they're okay before coming out and infecting somebody else.
Yeah.
Because we went to the grocery store yesterday and the lady was just hacking. She was just coughing and coughing. Yeah. I'm waiting for something to come out her mouth. Like, that's how hard she was coughing. I'm thinking to myself, like, you're standing here by the produce. You're coughing like that. The next person is going to touch whatever produce you coughed on. No. Think about where I am. Ain't nobody washing that. They're just going to walk away. I had to leave. I was just done. I couldn't believe it. Couldn't. You don't know what you have. I don't know if you're being treated, but at least wear a mask.
I mean, right, and that's the least that a person can do. And I mean, we've said that how many times? You know what I mean? That the least a person can do is wear a mask, wash your hands, and that's just protecting yourself, if nothing else. And yeah, the produce. I mean, that's always gonna be a thing. Because if it's not COVID, it could be salmonella or just something else. You want to make sure you wash.
But you don't even cover your mouth when you do it. That's what gets me. Oh, the way you cover it, you're covering it like this, right? What is this? Like, I don't get it.
Yeah. I mean, that's why I just try my best to put everything into my elbow or something.
Yeah, that's why I had to snatch my big son and duck for cover.
Oh, God. Yeah, I mean,
Can you imagine me trying to get him?
It's definitely, you know,
It's
I
just,
say unfortunate that people can't cough correctly. But yeah, I mean, it ends up affecting like how many people, and it's disgusting.
and that's why Amazon groceries are my thing. I would sit at home, wait for somebody to carry them all the way up them steep steps.
I've been trying to find the article that I was reading earlier, but
I hate that.
I don't know where it is. I'm gonna find it. But yeah, I mean, at any rate, it's all kind of ridiculous, and I just because I mean, the article did talk about like the what do people keep saying? You know how for like abortions, people would say it's like my body, my choice, everything. Like that was in the article, and that's what that's what the article was about. Where people are saying, well, it's my body, my choice, but yet, and it goes right in line with what you were just saying. Like you may be sick, and you're talking about my body, my choice. Oh, it talked about how the unvaccinated are making the vaccinated like a lot more sick and something like that. Which I mean, it's kind of like duh, but then it talks about why it said that. And it made sense. And let me see. Okay, maybe this is one of them. This one's by Forbes. I don't know if it's the same one, but no, it doesn't look. I hate all. The ad takes up half the page, and you can't see
And the article is like right there.
Come on, you're killing me, man. This one. Yeah, I don't think so. But at any rate, yeah, it just talked about how I don't know which one it is. I'll just read this one. So Forbes, it says unvaccinated people increase risk of I could see of COVID infection among vaccinated study finds. So unvaccinated people threaten the safety of vaccinated people, even with high levels of immunization against COVID-19, according to a new study published in the Canadian Medical Association Journal, countering a popular narrative that vaccination is purely a matter of individual choice and supporting policies requiring the shots. They're saying that the key facts are unvaccinated people pose a disproportionate risk of COVID-19 infection to vaccinated people, according to the peer-reviewed study from University of Toronto researchers, which examined the interactions between unvaccinated and vaccinated groups using a computer model. Yeah, so this was simulated. That's what I read in the first article. I was like, okay. So the model simulated the spread of COVID-19 under a variety of different parameters and mixing between unvaccinated and vaccinated people, including vaccine effectiveness and uptake, baseline levels of immunity among the unvaccinated, and the rate of recovery from infection. The model revealed a markedly higher risk of infection in all scenarios where unvaccinated and vaccinated people mixed, even the ones where immunization rates were high. The findings counter the common argument that the decision to get vaccinated is a personal one, the researchers said, as the unvaccinated are likely to affect the health and safety of vaccinated people in a manner disproportionate to the fraction of unvaccinated people in the population. So I guess they're trying to prove like, hey, all of you that don't want to get the shot, they keep crying, my body, my choice. Yeah, to a certain extent. But once you get sick and affect other people, then what? And I feel like we talked about this because how's that just not obvious?
Yeah.
You know what I'm saying? So for all those people that were crying, my body, my choice, and for those people that got sick, it's like, okay, you're sitting there affecting the people around you. But how does that make you feel? Is it still your body, your choice?
They don't care.
But I mean, the people around them is their family, so they have to care a little bit. So like at some point, it's. I mean, well, I think it's that they care, but I also think it's that they feel like, oh, we'll beat it, because a majority of people do make it.
Drink bleach, inject bleach into your
right. But right. At any rate, we do have to go to break. We will be right back.
This whole article talks nothing.
Beauty's in the eye. We complicate things when all along it's just perfect as it is. Beauty is from within. It's how you feel, not as how others see you. Skincare shouldn't be complicated. She's the Boss believes skincare should be nurturing, easy to use, smell delicious, feel refreshing, and look incredible. She's the Boss Cosmetics and Skincare brings you our botanical-based skincare line that's gentle, uncomplicated, and extremely effective for men, women, and youth. Feel confident and radiate a power glow that flows from the inside out. Exude an assurance that extends from the home into the conference room. Visit us at www.shes-the-boss.com or call us at 866-494-5945 to get yours today.
This year, give the greatest Mother's Day gift ever. Compassion International presents a Mother's Day celebration. Erica Campbell, Donnie McClurkin, Tamala Mann, and Anthony Brown in group therapy.
Thought I was worth saving.
Saturday, May 7th at the Chesapeake Employers Insurance Arena, formerly the UMBC Event Center. Tickets are on sale now. Get them online at Ticketmaster.com or the box office.
Hey, I'm Jenny James for Neatly Done Carpet Cleaner. You've probably been home a lot more. Maybe you have kids like me who spill all the time, and you've noticed that your carpet's not looking so good. Why don't you call Neatly Done Carpet Cleaner? They use a dry extraction service, so you won't have wet carpet all day long, and you can get back to doing the things you love with your family immediately. And it's a way to make your room healthier while improving your indoor air quality. You can do tile, slate, granite, ceramic, area rugs, and yes, they're pet-friendly too. Why don't you get a free, no-obligation estimate today? NeatlyDoneSanAntonio.com.
We don't break the laws. We just make up our own. The internet's best choice for music. She's the boss. Radio Network.
All right. So we are back, and we're going to be talking about Baltimore and Brandon Scott and blah blah blah. So this Fox 45 news article talks about a study that suggests the Baltimore residents largely are against calls to defund the police. And I mean, that makes sense to me because I know nobody in Baltimore is doing anything to block anybody up. So they're like, give all that to the cops. Especially because here there's such a big stitches get snit. What is it?
Snitches get stitches
rule, which is like the most stupidest thing I've ever heard in my life. But whatever. So anyway, this article goes into saying that it was a murder that spawned a movement, the aftermath of the killing of George Floyd, that saw thousands take to the streets nationwide and protest the police brutality and racial injustice, and soon after the birth of a new slogan. As reported by the Baltimore Sun, a West Baltimore organization, the Citizens Policing Project, wanted to take that issue to some of Baltimore's most depressed communities where lives were most impacted by violent crime and police misconduct, like Sandtown, Winchester. Yeah, and I know in Pigtown, which is close to Sandtown or something like that, there's a lot of speed, like car speeding and stuff, a lot of racing going on and things like that, and that in itself is going to be destructive because they're going to end up hitting a bunch of people. But anyway, according to the Sun, the study found that of 1,000 people interviewed, just 30% supported calls to defund the police. Fox 45 took the same question to neighborhoods around Baltimore. DeAndre Williams is among those who would like to see resources redistributed. Funding should go to different resources to provide more opportunity to the youth of the city. It's been taken away from them, so we need to restore it so there's more hope, he said. Another woman who didn't want to be identified told us this: I don't think anybody should defund the police. I think they should increase the budget for police. Well, that woman's insane. That's all I'm going to say about that. So reportedly, respondents in the study also largely supported increased funding for Baltimore City Public Schools, which who wouldn't support that? And I do agree with the other guy saying that the funding should go to opportunities for the youth because they are our future.
I mean, my thing is this: if Hogan is giving them $500 million towards the police, and you see how corrupt the police are, what I would do is, in order to provide some kind of policing, good policing, yes, it's warranted. The money is warranted to a certain degree. You need to open up more rec centers to keep these kids busy. Stop with the youth work and the rules of who can be in youth works and who can't. There's employers not hiring people, so YouthWorks is, on the other hand, hurt because there's not a lot of people signing up to have students work for them during the summer to make money because they're so afraid of these kids. Like, there's so many, it's, I think companies that are involved or enroll in YouthWorks to hire YouthWorks students, what should happen is they should have some kind of compensation. They should have a state level something, maybe not a grant or whatever, but they should give them something.
Yeah.
You know, I know it's hard for people to find jobs, and then there's hard for employers to find good candidates. And if you want an intern, somebody to come in the office, do filing for you, just random things, just to keep them off the street. Come on, employers. Like, I personally cannot do it because it's a privacy issue on our end. But if you're able to hire these kids from YouthWorks, and Governor Hogan, you talk a lot. I had nothing but good things to say about you in the beginning, but your whole thing has just sucked. It sucked balls. Okay? So what I'm saying is that $500 million, there should be something in there in that deal that is specifically speaking on ways to help these kids and keep them off the streets. When your home is traumatized and it's traumatized you your whole life, and you find a group of people outside of your home to treat you better than your own relatives are, I wouldn't want to go home either. But I ain't no street kid. Well, I'm not a kid anymore, but it just makes no sense. So how about we find alternative ways to help these kids from standing on the corners? PAL program. I keep talking about the PAL program. Bring that back. Bring that back.
No, the first thing they'll say is that there's no funding, but yet y'all want to give all this money to
$500 million
police.
to Baltimore City police officers that have, not all of them, but have robbed the city. We have to pay wrongful death bills, civil lawsuits. They're uninsurable, in my opinion. Between the commissioner, Norris, and all these people they brought from all these other states to be police commissioners in Baltimore City. Baltimore City ain't like any other city or state in the world. We are a different kind of beast. So I'm saying these are ideas you need to throw at it instead of just throwing money at the opposite.
I mean, in my opinion, we're like any other major city when it comes to crime. It's there and nobody's doing anything about it.
But
And
my whole
so-
thing is that when you bring somebody from out of state that's not in touch with Baltimore City, I
Yeah.
think you need to, hire within.
I mean, yeah, you and I have had this conversation, and we don't agree on that. But my thing is, I don't care where the person's coming from. If they have a plan that works, then it works.
But that's the
But
thing, though.
he-
They brought people from out of state and said, "Oh, this is my plan. I did this in my city, in my state, and it worked there." Yeah, it worked
but
there.
I think there's other reasons for that. I don't think it's necessarily a plan because, for one, it's obvious the reason why they're outreaching is because there's nobody in Baltimore that can obviously do the job right. Because if that was the case, then why would you go somewhere else and hire somebody? But as time goes on, hopefully the cycle of new people. But again, we have to look at the people that live in the city.
Mm-hmm.
We got to look at graduation rate. How many of these high school kids do you really think are going to end up in local government or any kind of government? Not many.
Yeah.
And if they do, their prospects are probably trying to get to Congress or be president or something else, even though a lot of things start locally. And I know in like high schools they try to do a lot of local stuff, and so maybe that might spark a bug in these kids to do something
No,
local.
police
but
are hated, so there's not
I'm
going to
not
be.
even talking about police.
Okay.
I said in high school they do a lot of these things related to government with the high school kids, and so maybe that might spark them to say, hey, like maybe I'll do something locally. But a lot of them have bigger plans, and that's fine. But to me, it doesn't matter where a person comes from. There's been plenty. I'm sure there's been cases of not just with police, but with whatever, where people come out of town or out of state and they can make something work. I just don't believe that Baltimore's invested in any of this stuff. And the people that are supposed to be helping out these out of towners who are coming in, I just don't think that it's that that they're doing their job. And I think there's funding issues. I think there's accountability issues. I think it goes into a lot of stuff that we don't always get to see. But yeah, because even the people that within who've had plans, they didn't work. So we can't say that it's because of someone out of town. There's something going on in Baltimore where these plans aren't allowed to succeed. Because how many other plans are there, like especially about schools? None of that stuff's been working out. We're supposed to be getting money from casinos.
That never happened.
Right. And so these schools are still shit.
Yeah.
So it's like nothing in Baltimore is working.
But the only time they talk about fixing something is during election years.
Right.
And now this is what's going on as far as Mosby, since they want like Ivan Bates and what's the guy from Fells Point?
Oh, the Indian guy?
Yeah.
Yeah, Theroux.
Theroux. And all these people keep saying that all this crime or lack of her convicting or prosecuting low-level offenses, it's her fault. That's why our crime rate is so high. No, that's not the case.
Yeah.
We're spending millions of dollars to somebody jaywalked. What was it? 600,000 people out of 600,000 people, 300,000 were stopped for traffic offenses, like on the crosswalk, walked against, during a no, do not walk sign, just stupid things like that. If you're willing to risk your life and cross when cars are coming, that's on you.
I do it all the time. If
I do
get
it
hit,
too.
then hey.
I've been doing it since I was a kid. I
Right.
don't care. Like, you have to time it just right. Keep it moving.
Yeah.
So police officers, we've noticed in the past couple of years, they really, in Baltimore City is what I'm talking about, we have not seen them being proactive. They've been reactive. They react to something with so much aggression and hate. I always used to want to know, why are you doing this job?
Yeah.
A friend of mine
it's
works,
about
a couple
controlling
of
the
them.
power.
Yeah, and a couple of them that work at police, BPD. And it's like basically they're told, hey, here's your badge. These are the rules, and do what you want to do.
Right.
Bring me these numbers.
So just to remind people before we go to break about Brandon's plan. So this article from Baltimore Sun. I'll just read it. So in Baltimore, Mayor Scott pledged Tuesday, and this came out the 11th, I believe, the 5th, my bad. Pledged Tuesday to tackle two of the city's most persistent problems, violent crime and vacant housing. In his second State of the City address, the speech, Scott's first delivered in person due to the pandemic, touted numerous investments made during his first year in office, many thanks to a $641 million appropriation from the Federal American Rescue Plan. The first-term mayor, a Democrat, has allocated nearly all of the funds and made substantial investments in both violence prevention and housing and blight initiatives. We've been through a lot together in the past 2 years, and we have still been able to advance by leaps and bounds, said Scott, speaking to a crowd that included most members of City Council, Comptroller Bill Henry, and State's Attorney Marilyn Mosby. Baltimore is rising, and that's a fact, Scott continued. Violent crime and gun violence will continue to be addressed. Our communities are being restored, and the way in which our city government operates is revived. Oh, is that what it said? Yeah, revived. So, highlighting a $50 million investment of ARP funds that has paid for several initiatives of his nearly one-year-old crime plan, Scott said he will address the results later this year of an internal review into Safe Streets, a violence prevention program that employs community members as violence interrupters. Safe Streets employees have repeatedly found themselves the targets of violence in the last year. Three were killed, deaths noted by Scott during his speech. In the coming year, Scott said he will launch a community violence intervention program that will expand on the capacity of Safe Streets. The mayor said he envisions a program that offers more extensive services to victims such as life coaching, hospital-based violence intervention, and school-based supports. We got to go to break. We'll be right back.
You could listen to one of those other stations, but what would your friends think? You could listen to one of those other stations, but what would your friends think?
Hey, I'm Jenny James for Neatly Done Carpet Cleaner. You've probably been home a lot more. Maybe you have kids like me who spill all the time, and you've noticed that your carpet's not looking so good. Why don't you call Neatly Done Carpet Cleaner? They use a dry extraction service, so you won't have wet carpet all day long, and you can get back to doing the things you love with your family immediately. And it's a way to make your room healthier while improving your indoor air quality. You can do tile, slate, granite, ceramic, area rugs, and yes, they're pet friendly too. Why don't you get a free, no obligation estimate today? NeatlyDoneSanAntonio.com.
Yeah, that's the sound of today's business community. It's a dog-eat-dog world and only the strong survive. The challenge is navigating the ever-changing business environment to put your business in the forefront. So how does your business keep up with the changes? That's where She's the Boss Network comes in. She's the Boss Network is an internet media network that's been helping businesses like yours get the exposure that you're looking for at reasonable cost by way of radio and video. They'll help you stay successful by navigating change and seeing the big picture. After She's the Boss Network analyzes your business and marketing strategies, you'll start to see a media presence like you've never seen in your business before. And She's the Boss Network doesn't stop there. They use their findings to create a practical plan of action, a plan that will get your business from where you are to where you need to be. There you go. Lock those dogs up for good by giving She's the Boss Network a call at 866-494-5945, extension 101, or by checking their website at she'sthebossradio.com. Again, that's 866-494-5945, extension 101, or she'sthebossradio.com.
Beauty's in the eye. We complicate things when all along it's just perfect as it is. Beauty is from within. It's how you feel, not as how others see you. Skincare shouldn't be complicated. She's the Boss believes skincare should be nurturing, easy to use, smell delicious, feel refreshing, and look incredible. She's the Boss Cosmetics and Skincare brings you our botanical-based skincare line that's gentle, uncomplicated, and extremely effective for men, women, and youth. Feel confident and radiate a power glow that flows from the inside out. Exude an assurance that extends from the home into the conference room. Visit us at www.shes-the-boss.com or call us at 866-494-5945 to get yours today.
We don't break the laws. We just make up our own. The internet's best choice for music. The Boss Radio Network.
All right, so we are back. And so yeah, during the break we were also discussing just I said I would like to see how many cases as far as Mosby that she she didn't, she decided not to prosecute because she considered it low level, and then how many of those people turned around and did something terrible. But even besides all that, I don't think that we could sit there and blame Mosby for that type of thing. I think each case has to be looked at individually. She doesn't control these people that are out running around with guns, robbing people, doing whatever, carjacking people, because I hear that's up as well in Baltimore. She's looking at the case. Okay, this kid has a gram, half a gram. Is that worth locking him up and ruining his life? No.
Because these are tax dollars, and that's what people don't seem to understand.
Well, there's also that.
And she's not the investigator. She's not the one bringing these cases to the prosecutors.
Right.
It's you have initial contact. That paperwork needs to be done right and truthfully. Then it goes to your commander who reviews it, and then there's a whole review board. They'll check it and send it to the prosecutor. The prosecutor can take it and look at it and be like, well, these offenses are not conducive to...
Yeah. So, and my point is that it's more so than taxpayer money. It's about their livelihood. Like, I still remember the white kid who raped somebody, and the judge was like, I don't want to ruin the rest of his life and let him off. No, he deserves to be in jail.
Yeah, because that's
now,
a violent crime.
And having half a gram and or a gram of weed. I mean, yeah, you could talk about the intent to distribute, but it's a gram. Like, who really like?
With a mice.
What's he gonna get for that? But my thing is like, okay, I'm about to ruin this 13, 14-year-old's life for half a gram of weed. Like, it doesn't make sense. Now, if that kid then turns around and, like I said, robs somebody or hurts somebody or something like that, that still can't be put on Mosby, in my opinion, because I mean, for one, she didn't know he was going to do that, and and a kid in Baltimore. I'm not trying to say this is a lawless city, but I mean, it's given that title "Run for its money." I'll say that much, but I just don't think that we can just lump all these different things together and be like, this is a bad person, and then want to put them under the jail. You know what I'm saying? Like, I think everything has to be looked at individually.
And look at it from Reagan years, the Say No to Drugs campaign.
That worked.
How about it? And Clinton signed in that oh my God, I've lost it. Too. No. But it was all out assault on the stop and frisk thing. The crime bill with Clinton, it's just been a downward spiral. And when you look at it outside looking in, you'll see that it's a targeted policy. It's a very targeted policy, and it's not about blacks and whatever, but look at the numbers. The majority of the people that were victims of the Stop Say No to Drugs, the MAD program,
DARE and all that.
DARE and all of these acronyms, all of these programs that they put in place, who is it hurt more so than anything? The crime is still there.
Yeah.
And it's not a black on black crime or white on white crime, and they're both wrong.
Right.
Like, stop hurting each other.
Yeah.
You know what I'm saying? So it's just frustrating as hell.
I mean, yeah, it really is, because when you try to break it down to the bare necessities, especially as far as like what the city or state or even the country may need, because we're talking about opioid addictions, we're talking about like so many different things.
Well, Johnson and Johnson was ordered to pay millions of dollars.
That thing you said. I didn't read it, but I saw it. But yeah, I mean, I think what it comes down to is having a bit of compassion and empathy for other people. I think everybody who even locally that are in these government positions, they just don't care.
Yeah.
I mean, we see that with the federal government. Again, excuse me, a lot of like Pfizer, I forget what the big one is, but a lot of these pharmaceutical companies, they knew what these drugs could do.
Merck, is that it?
And Merck, yeah. Because there's one on Netflix now where it was talking about, I think it was Netflix, the opioid addiction and how like they knew, but they kept prescribing these things. Or one was about a pharmacist whose son ended up dying, I think, from opioids or something. And so he started paying more attention to things, and even things that he was giving out. I mean, a pharmacist doesn't write the prescriptions, they just fill it. But you notice, like, okay, he said he noticed a lot of kids, I just watched the little trailer, but he said he noticed a lot of kids his son's age coming in with these prescriptions for like Xanax, and I think it was like Xanax and some other stuff like that. And he's like, what the hell's happening here?
Is these kids are mixing it up and coming with something
or
lethal?
just crushing it, like I always say, like The Weeknd in his songs, he always talking about crushing up Adderall and snorting it. Like, this is the stuff that they were doing to get high, and unfortunately his own son had passed from it. So I think the documentary is probably about his like road to dealing with that, and maybe trying to talk to not the government necessarily, but whoever he needs to talk to about changing certain things. But I mean, it's sad. It just starts with caring about your fellow human being, but that's not how certain Americans roll. They just want more money in their pocket. Bring it up, but it is what it is.
Yeah.
I thought